Hello and welcome everyone. In today's video, we are doing part 2 of advanced drug delivery to improve the solution of poorly water-soluble drugs. Here we are going to highlight surfactant use and lipid emulsifying drug delivery systems. Starting with surfactant. Surfactant is a substance that reduces surface tension. And what is surface tension? It is an attractive force between liquid molecules, where liquid molecules are attracted and pulled from all directions toward other molecules. However, the particles on the surface are missing the cohesive pull upward and therefore are pulled inward into the bulk of the liquid. This will create tension at the surface, which allow the liquid to resist any other external forces. So a poorly water-soluble drug would have difficulties in interfering with water because of this surface tension. It's just like a barrier, and hence won't be dissolved. In order to overcome this barrier, we should use a molecule that exhibit both water-attracting, hydrophilic, and water-repelling, hydrophobic regions, such as surfactant. The structure of surfactant enables it to lower the surface tension between the two immiscible substances and therefore allowing them to mix well. Take a look at this drawing here. When no surfactant is used, the oil and the water are separated. And if you try to shake or mix them, they will be dispersed, but only for a moment. After that, they would go back to their initial form. But if we add surfactant, it can overcome the surface tension by helping the two different components to mix together, as well as stabilizing this mix, so even after a while, the two layers will not be separated again. Now let's bring this concept back to our poorly water-soluble drugs. These drugs hate water, so they resemble the oil layer, and our gut environment is basically water. In order for these drugs to be absorbed, they need to dissolute, meaning they need to be mixed with water in order to form solution. But how this possible if these drugs are lipophilic? Well, we can achieve that by adding surfactant. It will lower the interfacial tension or the surface tension between the drug and the gut environment. So, by incorporating this surfactant, the drug can have improved dissolution, improved absorption, as well as bioavailability. And that will enhance the therapeutic efficacy of the molecule overall. Next is lipid emulsifying drug delivery systems. Usually, when fatty meals are ingested, lipase and bile salt will be secreted to aid the dissolution and digestion of food. So when poorly water-soluble drugs are given after fatty meals, lipase and bile salt that are secreted to digest the fatty meals will help solubilize these drugs, since they are lipophilic. So they resemble the food that we eat. And this can form something called emulsion, which is better absorbed than the drug initial form. Self-emulsifying drug delivery systems utilize this concept, but without the need for body's lipase and bile salt, and we will see how. Consider this drawing here, where the yellow circle is the oil, or in our case is the poorly water-soluble drug. The red circle is the surfactant, which represent the bile salt in our body, and the blue one is the water. If we administer the drug into our body with fatty meals, what happens is that the drug will, with the bile salt and the water all together, will form something called emulsion, which has better absorption and bioavailability than the poorly water soluble drugs. However, this scenario is highly affected by the food that we eat. So, if the diet is not rich in fat, this process might not occur and is affected by diseases such as diseases that affect the liver and the production of bile salt. So, we can take this concept and make from it a drug that will not be affected by food and disease. Take a look at the second drawing, where we mix the poorly water soluble drug with a surfactant, and we make them in something called self-emulsifying drug delivery system and the self-microemulsifying drug delivery system, the SEEDS and the SMEEDS in short. These systems, once they are administered in the body and at the gastric environment, when they interact with water, they will form emulsion, and therefore they are called self-emulsifying. What is great about this system is that they don't need the bile salt. Since the surfactant is already administered with the drug, these systems will not be affected by the diet or the diseases. It only needs water to form emulsion. The only difference between SMEED and SEED is that SMEED is micro in size. And remember, when the size is reduced, that means better surface area or higher surface area, and that lead to better dissolution. So SMEEDs are considered better than SEEDs. Now let's see the advantages of both SMEEDs and SEEDs. This graph represents the time concentration profile of cyclosporine. The empty dots represent the sandimune, which is the regular drug form without the self-emulsifying drug delivery systems, and the dark dots represent the SMEED form. You can tell from the graph that at time 2, the concentration achieved was the maximum. However, the Cmax of both the drugs is different. For the SMEED form, it was almost 1,000, while for the sandimune, it was almost 700. So that shows that the SMEED or the SEED can lead to increased Cmax. SMEED and SEEDs, since they don't depend on our body's lipase and bile salt, they will have lower food effect. So they are not dependent on the diet we eat, and we don't have to ingest fatty acid in order for these drugs to be absorbed and to have an efficacy. And that lead also to less variability in the plasma profile. So we can have more predicted plasma profile of these drugs. That lead us to the end of this video. I hope it was helpful. Thank you so much for watching, and if you have any question, please leave a comment.